In a move that has stirred both fascination and fierce debate across political and medical circles, former President Donald Trump has nominated Dr. Casey Means as the new U.S. Surgeon General, abruptly withdrawing support for his previous pick, Dr. Jeanette Nashewat, just before her scheduled confirmation hearing. This unexpected shift in direction has reignited discussion over Trump's evolving health policy platform as he ramps up his 2024 campaign, and has brought an unconventional figure into the spotlight. Dr. Casey Means is no ordinary nominee. At just 37 years old, she boasts a prestigious academic background, having graduated from Stanford University and trained as an ear, nose, and throat surgeon. But what truly sets her apart is not just her medical training, it's the radical turn her career has taken in recent years. After stepping away from clinical practice, Dr. Means co-founded the metabolic health startup Levels, a company aimed at tracking glucose levels to optimize health. Alongside her brother, Callie Means, she has become a leading voice in the burgeoning Make America Healthy Again movement, a grassroots initiative that challenges traditional medical paradigms and promotes lifestyle medicine over pharmaceutical intervention. To her supporters, Dr. Means represents a long overdue reckoning with a healthcare system that is too reactive, too drug-focused, and too influenced by corporate interests. She's argued passionately that metabolic dysfunction lies at the root of many chronic diseases and that the nation's health crisis cannot be solved by pills alone. Her best-selling book and numerous podcast appearances, including with controversial figures like Joe Rogan and Robert F. Kennedy Jr., have made her a popular, if polarizing, health influencer. She is part of a new wave of health advocates who blend scientific credentials with social media savvy and an anti-establishment ethos. But it is precisely this platform that has drawn heavy scrutiny. Critics have quickly pointed out that Dr. Means has not maintained an active medical license in Oregon since January 2024. She has not practiced medicine in a traditional clinical setting for over a year, instead focusing on digital health advocacy and public speaking. Moreover, some of her public comments have sparked alarm among mainstream medical professionals. She has questioned the safety of certain vaccine ingredients, particularly aluminum adjuvants, and has suggested that the current childhood immunization schedule should be re-evaluated, a position that public health experts warn could fuel vaccine hesitancy. Further controversy surrounds her association with figures like Robert F. Kennedy Jr., who has been widely criticized for spreading misinformation about vaccines. Though Dr. Means has not explicitly endorsed anti-vaccine conspiracy theories, her nuanced criticisms of vaccine protocols and emphasis on individual choice have led many to question how her views would translate into federal health policy if confirmed. President Trump, however, has been enthusiastic in his support. In a campaign rally shortly after the nomination, he called Dr. Means a brilliant and courageous doctor who understands what it takes to make America truly healthy again. He praised her for challenging Big Pharma, for promoting self-reliance in health, and for embodying the kind of outsider thinking he believes is necessary to reform bloated federal agencies. Still, the reaction has been anything but unanimous. Prominent medical associations, including the American Academy of Pediatrics and the American Medical Association, have expressed concern over her nomination. Senate Democrats have already signaled that they will closely examine her views on vaccinations, health equity, and her qualifications to lead the nation's public health efforts during an era still shadowed by the COVID-19 pandemic and growing mental health crises. Meanwhile, the public is split. Social media has erupted with both glowing praise and sharp criticism. Wellness communities and libertarian groups have rallied behind her, while scientists and clinicians warn of the dangers of platforming health influencers without recent clinical experience or peer-reviewed research to support their policy ideas. As Dr. Means prepares for what will likely be a contentious confirmation process, the stakes are high. The role of Surgeon General is not merely symbolic, it shapes national conversations on health, guides emergency responses, and helps set standards for medical communication. Whether Dr. Casey Means becomes the face of a new public health era or a cautionary tale of politicized medicine remains to be seen. What is clear, however, is that her nomination has already become a defining flashpoint in America's ongoing debate about what health really means, and who gets to define it.